If you have gestational diabetes, what should you do? The most important thing is to start testing your glucose before and after each meal. And things to remember are that before a meal, your glucose readings should be below 95, and after meal it should be below 140. And this has to be done before and after each meal. The reading checked after meal should be 1 hour after meal. So if you have 3 meals like breakfast, lunch and dinner, you need 6 glucose checks for these typical meal times. In addition to that, you need to have a bedtime glucose check as well. What does this mean? People with gestational diabetes need to have 7 glucose checks on a daily basis. This is the bare minimum number of glucose checks that you do need to do on a daily basis when you're pregnant. Now, 7 glucose tests have to be done from the time of diagnosis of gestational diabetes till the time of delivery of your baby. One of the ways of testing your glucose is to do a finger prick test and start monitoring your glucose on a diary. Another method is to start using your mobile with a sensor called Freestyle Libre. If you're doing finger tests, then you need to write them on a piece of paper before each meal and 1 hour after meal and show them to your doctor or diabetes specialist nurse to ensure that your glucose readings are in perfect target range. If you're using the Freestyle sensor, then there are multiple benefits you can have. One of them is that you don't need to do finger prick tests. Your glucose levels would be tested even overnight automatically by the sensor, and they can be shared across remotely with your doctor or diabetic specialist nurse. You need to have a smartphone which should be able to have the app called Freestyle Libre, and you need to have a doctor who is able to look at your readings remotely through the Freestyle Libre sensor LibreView platform. Monitoring is the key. Whenever you have gestational diabetes, you need to have 7 to 11 glucose checks done on a daily basis till the delivery of your baby. Finger prick tests is one method and Freestyle Libre scans is another method. It is your choice what you want to do, but there are multiple benefits if you're using the Freestyle Libre sensor. You need to check it before and after each meal. The before meal readings have to be below 95 and 1 hour after meal should peak below 140. If you're able to maintain these target readings, your glucose will be in perfect target range like any person who does not even have diabetes, and you can enjoy your pregnancy without having any problems. Good luck with your pregnancy and managing gestational diabetes.